Legal disclaimer. This tutorial is designed to be a supplement to, not a substitute for, professional care. You may have a unique situation that requires a slight deviation from these rules in terms of cleaning routine, removal technique, or wearing schedule. Do not summarily assume that each rule, statement, or piece of advice applies equally to all contact lens wearers. Your situation may be different. If you are unsure, please ask. If you are not a patient of Newton Eye Care, do not construe any of this as advice. We will not give contact lens advice over the internet or telephone. Hello and thank you for your interest. My name is Dr. Lee Newton and we're here at the office recording an instructional video for contact lens care. This video will discuss proper techniques for lens insertion, removal, and cleaning. This is meant for first-time contact lens wearers as a review after having completed a personal training session at our office, and it's also meant for future contact lens wearers to acquaint themselves with some of the terminology, care, and basic manual dexterity required. For the purposes of this video, the term contact lenses will apply only to soft contact lenses. Before we get started, I feel it's important to understand that contact lenses are medical devices. They can alter the health status of your eyes whether or not proper techniques are followed. They can only be prescribed and fit by a licensed professional. Although the vast majority of contact lens wearers experience clear, comfortable, problem-free vision, complications are possible just as they are with any medical device. The worst possible complication is loss of vision. This could stem from an infection or inflammation of the cornea, which is the front surface of the eye. Follow all instructions pertaining to contact lens care to the letter. If a problem develops, contact us immediately, even if it is after hours. Let's get started. Let's talk about lens insertion first. First, you need to wash your hands before handling contact lenses. The use of a mild liquid soap is preferred. Most soft lenses come in a plastic receptacle sealed with a foil top. Peel back the foil top, then gently swipe your fingertip along the bottom to remove the lens. Rinse the lens with fresh solution, as the initial solution can stagnate over time. Set the lens like a bowl on the top of your finger. Now look at it from the side, paying specific attention to the very top edge. Do you see how the very top edge appears to be straight up and down, like a salad bowl? That is the correct way to apply the lens to the eye. Let's flip the lens inside out. Now look at the same position on the lens. Do you see how the edge flares out at an angle? That way is incorrect. Usually, applying a lens in this orientation will feel incorrect as well, but I want you to be able to know by looking at the lens. Some lenses actually have inversion indicators on them, but because they may not be the best lenses for you, I want you to be comfortable with just looking. Let's assume that you are right-handed. Place the lens on your right index finger. Use the middle finger of your right hand to pull your lower eyelid down. Consider pulling your upper eyelid up with your other hand from above. Now your lids are out of the way. Try to look straight on. If you have done well up to this point, the lens will transfer from your finger to your eye fairly easily. Blink a couple of times gently. This will help work out any air bubbles that may be present. Congratulations, the hard part is done. Now let's remove the lens from your eye. Again, starting with dry fingers and good eyelid control, squeeze your fingers together to gather the lens and gently pull it off your eye. Now let's talk about the cleaning part. This process really has 3 steps: cleaning, rinsing, and disinfection. Most of you will be using a chemical-based multi-purpose solution such as OptiFree, Renew, or Complete. Some of you will use a peroxide system such as Soflon One-Step or ClearCare. If you're using a chemical-based system, place the lens in the palm of your hand and squirt about 4 or 5 drops of the solution on the lens. Now rub the lens gently with your fingers, making sure each side gets rubbed for 20 to 30 seconds. Now that you've loosened the dirt and debris, rinse off the lens with a few more drops of the same solution. Now the lens is clean and ready to be disinfected. Place it in the case and fill the lens well about 3/4 full with solution. Make sure the lens is submerged and put the cap on. After 6 hours, the lens should be adequately disinfected. My opinion on the chemical-based systems that claim no rub is to blatantly ignore that statement for 2 reasons. Number 1, You will find that if you don't want to rub, you will consume so much solution by rinsing according to their protocol that it is not even economically feasible to do this. Number 2. All studies on this subject have shown that a brief 20 to 30 second rub helps maintain a cleaner lens surface than not rubbing. A cleaner lens surface means clearer vision, better comfort, and a reduced risk of complications. If you're using a peroxide system, place the lens on the appropriate side of the holder. Do the same for the other lens. Fill the vial to the fill line and insert the lenses on the holder and screw it on with the threads. Pay special attention to the red cap and the text that says, "Do not put cleaner in eye." The oxidative system contains hydrogen peroxide and will really burn your eyes if it comes in contact with them. It is neutralized after a 6-hour soak. Most contact lens complications produce either blurry vision, some degree of redness, and some amount of discomfort, or any combination of the above. Infections, either bacterial, viral, fungal, or protozoan, are also possible. Inflammation inside the eye is also possible. To sum it up, just remember: look good, see good, and feel good. Following is a list of do's for contact lens wearers. Care for your lenses properly. Have current backup glasses. Allow your child to wear contact lenses only if you feel he or she is responsible enough. Have your eyes examined at least yearly if you're a contact lens wearer. Wash your hands before handling lenses. Replace your lenses regularly according to the schedule we've prescribed. Repeat the cleaning and disinfection process if the lenses have been stored for longer than 30 days. Replace your lens case at least every month. And here is a list of don'ts for contact lens care. Do not use tap water to rinse or soak your lenses. Share your lenses. Put lenses in your mouth. Use generic cleaning solutions. Studies prove they are not as effective. Try to stretch the wear cycle beyond the prescribed interval. Allow your lenses to come into contact with cosmetics or hairsprays. Generally, it's better to apply lenses before these products, as your hands will be cleaner. For similar reasons, remove lenses before cleaning your face at night. Wear lenses while in a hot tub. Ideally, you shouldn't wear them while swimming either, but we can discuss this on an individual basis. Reuse solution. Dump it out and let the case air dry. Or rinse the case with hot water and still let the case air dry. We hope this contact lens video has been a good learning experience for you. We thank you for taking the time to watch it.